Okay, let's dive right in. The COVID-19 pandemic did more than just test our amazing doctors and nurses. It put our entire global healthcare system under a microscope. And what it revealed was this shocking critical weakness. But it also gave us a once-in-a-generation chance to build something so much better. So we're going to explore that weakness and the really ambitious global plan that's in motion to fix it. You know, it almost sounds like a joke, right? But it's absolutely true. In the middle of a 21st century pandemic, life-saving health data was being sent around on technology that was cutting edge back in the 1980s. In places like Australia, contact tracers were just swamped by these slow, manual paper systems. This wasn't just a minor inconvenience, it was a serious bottleneck that crippled our ability to respond quickly. And really, those fax machines, they were just a symptom. They were pointing to a much deeper, much more systemic problem. The digital backbone of modern medicine, our health information systems, were dangerously broken and just not ready for a crisis. So here's the heart of the issue. Our most vital health information is very often locked away. It's trapped in thousands of these disconnected digital islands, or what experts have started calling data silos. Think about it like this for a second. Imagine if every single bank used a completely different currency, but there was no exchange rate and absolutely no way to transfer money between them. That's pretty much the state of our health records today. Every hospital, every clinic, every lab has its own system, and they almost never speak the same language. And because of that fragmentation, your complete health story is almost never in one single place. So the key to breaking out of this data prison is this concept called interoperability. Now I know, it's a fancy word, but it's for a really simple, powerful idea. Just getting all these different systems to finally speak the same language so they can securely share information when and where it's needed the most. But, making this happen isn't just a tech problem. That's the tricky part. True interoperability means we have to get four completely different layers all working together. You need the laws to actually allow data sharing. You need the organizations to agree on the process. You need the data to mean the same thing everywhere. And then, finally, you need the technology to actually connect it all. So, the pandemic really served as this massive global wake-up call. And in response, experts from medicine, from academia, from the tech industry, they all came together to create a blueprint for a connected health future, a real roadmap to get us out of this mess. And this shows the huge shift in thinking that's happening. We're moving away from this old system of isolated data silos and just reacting to crises. And we're moving towards a system that's connected, proactive, and built around a single, integrated source of truth for every single patient. And look, this isn't just some theory on a whiteboard. It's really happening right now. You've got foundational models like Europe's EIF that are providing the guidelines, and you have these global calls to action, like the Riyadh Declaration on Digital Health, that are building the momentum for this worldwide transformation. These global efforts have kind of boiled down to 5 core principles. You can think of it as a simple but really powerful framework for building the future of digital health. It's called the 5 T's. So the first T is team. And this requires a whole new way of thinking about who is actually on the health team. This is all about tearing down the walls between government agencies, university researchers, private tech companies, and our hospitals. But, and this is the most important part, it means putting you, the patients and citizens, at the very center of the team, as active participants in your own health journey, not just people things happen to. The second T is transparency and trust. And this one is huge because, let's be real, none of this works if people don't trust the system with their most sensitive information. Earning that trust means being radically transparent about how our data is being used. It means giving you, the patient, actual control over your own information and respecting your privacy and consent at every single turn. It's about building a system that people can truly believe in. Third on the list is technology. But this isn't just about getting newer, shinier gadgets. It's about having smarter, more connected technology. This is where that big word, interoperability, really hits the road. It means making sure that electronic health records, EHRs, can finally talk to each other. It means making all our health data fair, which stands for findable, accessible, interoperable, and reusable, so we can finally turn these vast amounts of information into real, life-saving insights. All right, the fourth T brings us to a really critical new concept, techity.
Tech equity is all about making sure that the amazing benefits of digital health don't just go to the wealthy or the tech savvy. It's a deliberate, strategic effort to use technology to close the health gaps in our society, not make them even wider, by making sure everyone has the access and the skills to get on board.
And finally, you take all of that and it leads to the fifth T, total transformation. This is the ultimate goal, right? To use these principles to digitally transform our entire health system from the ground up to make it stronger, smarter, and way more resilient for whatever challenges come next. So that's the high-level strategy, but what does a fully connected, interoperable health system actually mean for you in your day-to-day life? Let's bring this all the way down from global policy to your own personal health. Forget the big frameworks for a second. What does this future actually feel like? Well, it means no more filling out these same paper forms over and over and over again. It means when you go see a specialist, they instantly have your full history from your family doctor. It means you have secure access to your own health records right on your phone. And thinking bigger, it means we have a public health system that can actually spot the next threat and stop it in its tracks before it ever becomes a crisis. So this transformation, it puts incredible power at our fingertips to improve and protect our health. But it also leaves us with this profound, really important question to carry forward. As our health data becomes more connected and more valuable than ever before, who should ultimately be in control?